All I could say is that, this was such a blessing. And I said, God sent these people, because I was in the hospital. I knew nothing about the program. And was like, I said, well, I guess I have to go into a nursing home. And my daughters were so upset, you're not going into a nursing home. And it was like God sent the individual and told me about the program. And so when I came home, the day after I came home, a nurse was here and explained the entire program to me and took care of what would go on to be about a month and a half of caring for me.
We should be doing this. We should be following patients in the hospital and that same nurse providing continuity of care in patients' homes, because patients aren't discharged. They move from 24/7 care in some cases to very little. So to prepare them for that transition, they know that this nurse is going to be with them. It's an extraordinarily comforting a source of support for individuals. We've been able to track all the things that go wrong within that first 24 hours, and the nurse knows what to focus on during that first visit in order to prevent the seeds of readmission being planted that day and resulting in bad outcomes 30 days later or 60 days later, etc. We've tracked that patients are functionally, physically, emotionally at a low ebb within a couple weeks after discharge. That results in an outreach by nurses, either through visits or phone, etc., which looks like common sense, but it's really based on very strong evidence about the things, the trajectory that most of these individuals are on, when they need outreach, what's the source of their problem, and what are the best ways to respond to it.
I think that we're most successful in this program when we form a really tight bond with the patients. And so that does start when we initially go in and see the patients in the hospital. So we like to have this continuity of care, to have the same nurse who's going to see the patient on the outside also see the patient while they're in the hospital. This way the patient can trust us. We really want to reinforce to them that it's important to call once there's a change in your status, I feel that by us coming in every day and knowing what they've been through, knowing where they need to be when they go home, I think that we help to relieve some of that stress, especially when the patients feel comfortable enough to call us if they do have any questions. Because it's really critical those first few weeks coming out of the hospital, because they're very fragile and many things can happen. There can be a system breakdown somewhere. So it's really important to be on top of what's going on during that time and to form that relationship with the patient, so they will call me. I really enjoy what I do. I love being a nurse, number one. And I'm so glad that I went back to become an advanced practice nurse, because I just feel like now I have the knowledge to really help and make changes. And doing this role as a transitional care nurse, it has just really opened up my eyes to really see all the problems that are in our system and how many people really don't know how to navigate the system.
To me and to the nurses that have been involved in it, it really is quintessential nursing. It is, I think, very much what our history has said nursing brings to the healthcare delivery system. This sense of, really focusing on the big picture, on the whole person, and on, using whatever creative resources and juices people have to figure out how to problem solve in an advocacy model on behalf of these patients and their families.